Hey, what's up everyone? It's Brian from the Exact Cybersecurity and IT YouTube channel. Welcome to another video, and in today's video we are going to discuss the recent cyber attack against Capital Health, a New Jersey health system. Discuss the incident details, potential consequences for the health system across the US because they're being impacted like crazy right now. And we're going to provide actionable insights for hospital administrators to strengthen their cybersecurity measures and prevent similar instances like this happening to them at their hospital. But before we get into that, please remember to subscribe to our channel, like this video, and if you're so inclined, hit that notification bell so when we put out videos like this, you're notified and you can get the latest on who's kind of being cyber attacked out there and start learning what you can do to defend against these cyber criminals. So now that you subscribe to the channel, let's get into the details of what happened over at Capital Health a few days ago. So on November 30th, 2023, Capital Health experienced a cyber attack that resulted in network outages. The healthcare system, which operates hospitals and primary care offices in New Jersey, identified the disruption as a cybersecurity incident. They promptly notified law enforcement and engaged cybersecurity experts and forensic experts and information technology experts to help them through this situation. This is a typical response that we see from most businesses and hospitals when we see a cyber attack. Let's get into what the consequences are for healthcare systems when they fall victim to a cyber attack like the one Capital Health has experienced. Such cyber attacks can have severe consequences for healthcare systems, as you can imagine. In Capital Health's case, the incident led to disruptions in services including the unavailability of outpatient radiology and the rescheduling of vital medical appointments. Surgeries were prioritized based on urgency and patient condition, and the potential consequences for a healthcare system when they're doing things like this include things like patient care disruption, when you're either not able to meet these needs of patients and you potentially have to divert them to other facilities, or your care isn't at the level as it would normally be if your systems were up and running, because you're basically doing everything like you did before there were computers and you're doing it mainly all on paper. So hopefully these places and these hospital systems that are being impacted, because we have another hospital system out there that is being impacted as we speak, and hopefully they have these plans in place so they have systems and processes around what to do with the paperwork and how they're going to process it once the systems come back online. The other awful part of a cyber attack against a hospital system is the fact that they hold a lot of really sensitive data that maybe most people out there would not want to fall into hands of people who shouldn't have it. And in the case of a data breach like this, the exposure of that sensitive patient and financial data can lead to privacy breaches and other legal consequences, certainly for the healthcare system. But when you see things like this happen, you will see people victimized as a result of their data being stolen through phishing attacks, through scams, you name it. Cyber criminals are not stealing this data just for fun to get money from the hospital system. There's definitely a whole other side of this through scamming and phishing that happens in the cyber criminal world once they get their hands on this data. And when that happens, these people, when this starts happening to them, band together, and usually they're approached by lawyers today who are looking to file class action lawsuits against these hospital systems and any business that gets cyber attacked today. You're going to face these class action lawsuits from the people and the lawyers who represent these people when it comes to their data being exposed when it shouldn't have. And as we've seen with previous health system cyber attacks, UHS comes to mind. Cyber attacks can result in significant financial losses for healthcare organizations, and that more than likely is going to happen here with Capital Health. And finally, one of the other big outcomes from a cyber attack is the fact that you will suffer reputational damages to your corporate and brand name. Such incidents can erode trust in healthcare institutions, affecting their reputation, where patients may decide that they would rather go elsewhere because they're not sure whether or not their data and their information is going to be safe if they're treated at a hospital who's had a cyber attack, especially had one recently. And we know this sucks for Capitol Health, right? They're going to go through something that they've never gone through before, and it's going to take them time to not only get back on their feet, but also it's going to take them time to learn how to recover properly, and hopefully they can. So let's discuss some actionable tips for hospital administrators to strengthen cybersecurity measures and prevent similar incidents happening to them. As I mentioned, another hospital system, Advent Health, is also dealing with a similar cyber attack, and hospitals just in general are getting hit like crazy across the United States. Some of the things that we see hospitals fail to do is regularly update their software. So you want to make sure that you have a plan to regularly update your software. This includes both operating system software. It also includes software that you install like Office, Word, Adobe, things like that. You want to make sure that you're updating those free programs that you might download off the internet to help you do your job. Employees across the company may do this. Hopefully you're not allowing it to happen too frequently. When you do, make sure somebody's keeping an eye on those programs. Make sure there's not updates for security reasons. Finally, you want to make sure that you're getting that firmware on those IoT devices, those access points, TVs, other devices you may have plugged in to your network. Make sure you're updating those. Hackers love to use these things to move laterally and to infect and affect more devices on your network. And let's make sure you're training your staff. This is a big thing in hospitals. I see friends with a lot of people that work in hospitals. They watch my videos and they say, "Hey Brian, I heard you say this on your channel, and you know what? We do this. I use my personal laptop in the hospital I work at." And I've been literally told that by people, and these are things that employees should know that they can't do. When that individual told me that, that's the first thing that came to my mind is, wow, they're not training their employees like they should on the things they should and shouldn't do when it comes to using personal devices for business or bringing personal devices into the network. That shouldn't be allowed at all in any hospital. Somebody's personal device, an unmanaged device as we call it, should never be allowed to connect to a hospital computer network. Access controls. This is a big one. Yeah, we see doors and locks and things like that have access controls in hospitals and medical facilities, but what about your computers? Are you allowing password sharing? Are you allowing people to log into these systems using maybe common usernames and passwords? These are all things that we see out there in the wild when we're assessing hospitals specifically, where there might be sharing of usernames and passwords to log into systems and things like that. And you want to make sure that you have this stuff locked down and you know who is logging into what and who's accessing what. Having generic accounts or having machines that don't lock on their own when people walk away from them and things like that. These are all things that hospitals need to be aware of, need to be making sure that they're taken care of, because it doesn't necessarily have to be a hacker over the internet to attack you. Sometimes they're right inside your hospital when they gain access to these things. But either way, you're going to want to make sure that you have these precautions, and even more so, don't be sharing passwords. Make sure everybody has their own password, username and password, and they're required to use that and not share it with anyone. The next one I'm going to throw at you is have regular cybersecurity assessments done on your network. Most of these hacks that we analyze with these hospitals, it's pretty clear and evident that they didn't have a cybersecurity assessment done, because when it comes out and we find out how they were actually hacked, it's usually because something wasn't done or wasn't taken care of, which would have been identified through a regular cybersecurity assessment. If you run a large hospital or a large hospital system, you should be doing these on a regular basis, and I'm not talking about annually. You need to do these things quarterly. Things change too quickly today. Hackers are getting too good today. Vulnerabilities are discovered on a daily basis, hundreds of them, and you need to make sure you're staying on top of all of this stuff. And that's what cybersecurity risk assessments reveal to your hospital. Data encryption is the next one I'm going to throw at you. Make sure you're encrypting the data, especially PHI. This is critical. It's critical for HIPAA. You need to be doing this stuff, and it's the easiest way to make sure that if data or systems or hardware falls into the wrong hands, somebody can't easily access that. Encryption should be on all sensitive patient information, all financial information that hospitals deal with, to protect it from unauthorized access in case of a breach. Hospital administrators should also make sure that they have have a robust backup and recovery plan. We talk to a lot of hospitals out there. We look at a lot of networks. We look at a lot of operations within IT and hospital systems. And we see that, yes, a lot of them think they have really good backups or great backups. But the problem is they don't assess those backups, or they don't do test restores on a regular basis or a frequent enough basis. And that puts you at risk, because if you're just relying on the logs or the reports that you get from your backup system, more than not, those systems aren't recoverable when a bad event happens. You can't rely on those reports. They're good for daily checks and things like that, but you're going to want to have your team, or bring in a team who can assess your backups, spin them up in a test environment, spin them up, and make sure that the data you are backing up is accessible. It's accessible in the time frame that you need it, and you don't have any issues with this data, because you don't want to figure this out when you're dealing with a cyber attack that your backups don't work, because that leads you to needing to either negotiate and pay the ransom, or it can be the reason that you don't come back up at all. And finally, hospital administrators collaborate with experts. Establish partnerships with cybersecurity experts, cybersecurity professionals. They can keep you not only up to date on all the things like I'm doing here, but they can give you threat intelligence, and they'll help you stay ahead of these evolving threats. Like I mentioned with a cyber risk assessment. If you do cyber risk assessments and have them done by a cybersecurity expert that you develop a relationship, that's a win-win for your hospital system. You should also develop relationships with FBI, CISA, and law enforcement, because they're also going to be able to give you information when other hospitals are attacked. But should you need them, they will come and help you, and you already have those relationships established. You can put those contacts in your incident response plan rather than trying to run around and find them during an event. Pre-plan for this stuff, have these relationships set, and it's going to make your incident response a whole lot better and easier. Capitol Health, the cyber attack, it serves as a stark reminder of the cybersecurity challenges that healthcare systems face across the US. By implementing these proactive measures that I've gone through in the video today, plus doing more as your cybersecurity maturity at your healthcare system matures and improves, you can always do more. But these are the basics. These are the things that I think you need to do right away to help protect yourself from a cyber event and it being worse should one happen to you. So don't wait. Implement these measures so hospital administrators can better protect their organizations from cyber criminals and cyber attacks. I'm Brian Horning with Exact Cybersecurity and IT. If you need help with this stuff, there's links down below in the description where you can reach out to our company to get help with anything you might need around cybersecurity or IT. And please remember to like and subscribe to our channel. We'll see you in the next video. Take care, everyone. Stay safe.